Hello and welcome to this introductory presentation about MO1031 mental health across the lifespan. This module builds rural generalist knowledge and skills in service provision for clients experiencing mental ill health who are living in rural and/or remote communities. You'll extend your knowledge, skills and clinical reasoning in assessment and care planning within the context of multi and interprofessional practice and local service strategic intent, drawing upon rural generalist service delivery strategies to manage complexity in delivering evidence-based healthcare and unwanted variation. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of the etiology, pathophysiology, predisposing factors, clinical presentation and potential causes of mental ill health and assessment, and clinical reasoning skills to formulate and communicate care plans designed to optimise care in the rural and/or remote settings in accordance with best practice guidelines and local service strategic intent. This module goes for 6 weeks for 22 hours expected workload. You can see the weekly topics here. In week 1, Introduction to Mental Health, you'll identify a client for assessment item 1 and gain their consent to partake in the activity before accessing and familiarising yourself with your client's relevant clinical information. You'll learn about the prevalence of persons experiencing a mental health condition in the rural and/or remote contexts at both national and public health network levels. You'll learn more about the focus of prevention of mental health as it relates to the Australian Government's National Preventative Health Strategy 2021 to 2030 and the impact of determinants of health across the lifespan. Lastly, you'll consider culturally appropriate mental health care for Aboriginal and Torres Strait Islander people, people from rural and remote cultures, and people from multicultural and minority groups. In week 2, Mental Health Recovery, you'll refresh your understanding of the recovery approach to mental health care by reviewing parts of the National Framework for Recovery-Orientated Mental Health Services and topics generated from a 2023 overview of systematic reviews and qualitative metasynthesis of mental health recovery. You look into current mental health service gaps in Australia, taking a closer look at psychosocial supports and disability. You consider the relationships that support recovery through the rural and/or remote lens, including family, friends and carers, peers and therapeutic relationships. Finally, you'll submit the first 2 weeks of your module workbook by the due date to receive feedback on your learning so far. In week 3, learn about your client's condition. You'll test your knowledge of your client's specific mood or anxiety disorder by answering as many questions as you can about it before filling in your knowledge gaps by engaging with supplied resources. You'll identify and make contact with at least one health professional different to your own who works with clients experiencing the condition in your local area, and ask if they'd be willing to discuss screening, assessment and interventions in the coming weeks. You'll refresh your understanding of the rights of people living with a mental illness before considering the role of mental ill health in both child protection and elder abuse. Lastly, you'll consider suicide and self-harm in the rural and/or remote context. In week 4, Assessment, you'll locate assessment and intervention evidence for your client's condition from the perspective of multiple professions. You'll closely review screening and assessment options and make contact with the health professional identified in week 1 to discuss screening and assessments from their professional perspective before preparing for the upcoming assessment with your client. In week 5, Intervention, you'll review the interventions relevant to your client using the evidence sourced earlier before making contact with the health professionals identified in week 1 to discuss interventions from their professional perspective. You'll also identify services relevant to your context and client, discuss your learning to date with your supervisor, and draft a care plan for your client. In week 6, this week you'll compare your care plan with evidence-based guidelines before troubleshooting the complexities of delivering evidence-based healthcare. You'll discuss your care plan with your work-based supervisor for the final time before submitting assessment item 1. A single assessment task is due at the end of the module in week 6. The task is a written care plan that addresses the issues and goals for a consumer with a diagnosed mood or anxiety disorder. You'll have the opportunity to submit a formative piece of work at the end of week 2. This is the first 2 weeks of your module workbook, which is not marked but will give you some feedback on how you're going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we'll hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.